Have you ever seen a tall, sturdy tree suddenly collapse? Not because of a storm, not from lightning, but simply because the soil beneath it silently dried up. That's what low blood pressure can be like. It doesn't strike like a heart attack. It doesn't scream like a stroke. It whispers, quietly, steadily, until one day, you feel the floor before you see it. Maybe you've stood up too fast and felt your vision dim. Maybe your heart has raced out of nowhere, not from emotion, but because your body is struggling to push blood where it needs to go. And then we tell ourselves, maybe I'm just tired, maybe it's age, maybe it's nothing. But what if that nothing is the first warning sign? What if your dizziness, your fatigue, your fainting spell are your body's way of saying, I need help? In today's video, you'll discover the surprising causes behind low blood pressure that most seniors never hear about, subtle symptoms that lead to dangerous falls and hospitalizations, and most importantly, what you can do right now to protect yourself. Here's the truth no one tells you. Low blood pressure is not always harmless. In fact, in older adults, it can starve the brain, weaken the heart, and take away your balance, sometimes permanently. So what really causes low blood pressure? Let's uncover the hidden triggers before they pull you down without warning. When we think of blood pressure problems, our minds almost always jump to high blood pressure, the so-called silent killer. But what if there's another silent threat? One that doesn't strike loudly, but fades you out slowly. That's low blood pressure. Also called hypotension. It happens when your blood pressure drops below 90/60 millimeters of mercury. Sounds harmless? Think again. Imagine this. You wake up in the morning and stand up to get a glass of water. But before you make it to the kitchen, the world tilts. Your legs wobble. You feel faint. Next thing you know, you're on the floor, confused, scared, maybe even injured. This isn't just a bad morning. This is orthostatic hypotension, a common form of low blood pressure in older adults, where the body can't adjust quickly when changing position. It's responsible for thousands of emergency room visits each year due to falls, fractures, and even brain injuries. So what's the real danger? Low blood pressure starves your organs of oxygen and nutrients. When your brain doesn't get enough blood, you may feel lightheaded, confused, unsteady, or even faint completely. When your heart doesn't get enough, you may feel fatigue, cold hands and feet, rapid heartbeat trying to catch up. And the worst part? These symptoms often go unnoticed or dismissed as just aging. But aging isn't the problem. Circulation is. According to the National Institutes of Health, NIH, older adults with chronic low blood pressure are at higher risk for cognitive decline, falls, and even early death if not properly managed. This isn't about numbers on a blood pressure cuff. It's about your ability to stay upright, sharp, and safe. So the question is no longer, is low blood pressure bad? It's, is my low blood pressure putting me at risk today? The answer depends on what's causing it, and that's exactly what we'll uncover next. Sometimes the body doesn't shout, it whispers. And those whispers, they often come in the form of everyday moments we brush off. Feeling dizzy when standing up, a sudden wave of fatigue mid-morning, blurry vision after bending down, a strange chill in your fingers even when it's warm, a heart that races, not out of excitement but confusion. You might think, I just stood up too fast. I didn't sleep well last night. I'm just getting older. But what if these small signs are tiny cracks in the foundation, warning that something deeper is out of balance? Your brain knows first. The human brain uses nearly 20% of your body's blood supply, and it doesn't like to be ignored. When pressure drops, the brain feels it instantly. That's why one of the most common symptoms of low blood pressure is lightheadedness, brain fog, or even moments where you zone out without realizing it. Over time, this lack of consistent blood flow can chip away at memory, concentration, and emotional balance, making daily tasks harder and more exhausting. And then there's your heart. Your heart tries to compensate for the drop. It starts beating faster, like a car stuck in low gear, revving but not going anywhere. You may notice a fluttering in your chest, shortness of breath, or the sense that your body is working too hard, even when you're doing very little. The real danger? Low blood pressure often doesn't feel like an emergency, until it is. Many seniors don't realize anything is wrong until a fall, a fainting spell, or a trip to the ER forces them to ask, "Why didn't anyone warn me?" That's the tricky part. These symptoms are easy to miss and easy to blame on age, but they're not just aging. They're early warnings your body is trying to send you before something serious happens. So now the question becomes, what's causing these drops in pressure? And can you stop them before they stop you? Let's look deeper. You don't need a serious disease or a scary diagnosis to have low blood pressure. Sometimes it's your daily routine, done on autopilot, that quietly pulls the plug. Think of your blood pressure like water in a garden hose. The pressure needs to stay steady to keep things flowing to your brain, your heart, your muscles. But what happens if you start poking tiny holes in the hose? Not one big burst, but a dozen small leaks. That's what certain lifestyle habits do. Let's take a closer look. 1. Not drinking enough water. You might not feel thirsty, especially as you age, but your body still needs hydration to maintain blood volume. Dehydration is one of the leading causes of sudden blood pressure drops in older adults. And here's the twist. By the time you feel thirsty, you're already behind. Tip: keep a water bottle nearby throughout the day and sip often, even if you're not thirsty. 2. Skipping meals or eating too little. Your body needs nutrients to fuel your circulatory system. When you skip meals, especially breakfast, or eat diets too low in salt or calories, your blood sugar and blood pressure can dip dangerously low. For many seniors trying to eat light or lose a few pounds, this can backfire. Example: a 68-year-old woman in Arizona fainted after a light salad lunch. The cause? A combination of low sodium and low blood sugar that tanked her blood pressure within minutes. 3. Alcohol and caffeine. A glass of wine here, a cup of coffee there, it seems harmless. But in some people, alcohol acts as a vasodilator, widens your blood vessels, which lowers pressure. Meanwhile, caffeine might temporarily raise it, then cause a crash later. It's not about eliminating them completely. It's about timing and balance. 4. Sitting too long. Too much sitting can cause blood to pool in the legs, making it harder to return to the heart and brain. This is especially true after meals or long TV sessions. Tip: get up slowly, flex your feet, take short walks around the house every hour. These habits may seem small on their own, but together they form the perfect storm for hypotension. And if you're also taking medications, that storm could hit even harder. Sometimes, the very pills meant to protect your heart can quietly push your blood pressure too far down. It's like adjusting the volume on a radio, trying to lower the noise but turn it too low, and suddenly you can't hear anything at all. That's what can happen when medications, especially those for high blood pressure, start overcorrecting. 1. Blood pressure medications, antihypertensives. Ironically, one of the most common causes of low blood pressure in seniors is treatment for high blood pressure. ACE inhibitors, beta blockers, calcium channel blockers, diuretics, water pills. All of these are designed to relax blood vessels or reduce fluid, lowering pressure. But sometimes your body changes, weight loss, dehydration, aging kidneys, and the same dose becomes too much. Example: Mr. Thomas, 74, had been on the same blood pressure meds for 10 years. One day, he fainted while gardening. After a checkup, his doctor realized his blood pressure was dropping below 85/55, too low for his brain to get enough oxygen. 2. Medications for Parkinson's, depression, or anxiety. These drugs can interfere with your autonomic nervous system, the part of your body that automatically adjusts blood pressure during movement or stress. Levodopa, Parkinson's. Tricyclic antidepressants, anti-anxiety meds. They may cause orthostatic hypotension, a drop in pressure when you stand up, making you feel off balance, especially in the morning or after meals. 3. Diuretics and dehydration combo. Water pills are often prescribed for heart failure or high blood pressure. But combined with hot weather, age-related thirst loss, or too little fluid intake, they can lead to severe dehydration, shrinking your blood volume. Reminder: if you take a diuretic, always check in with your doctor if you experience dizziness, dry mouth, or reduced urination. So what's the solution? It's not about stopping your medications. It's about recognizing when your body is saying, "Hey, something's changed, I need a recheck." Regular blood pressure monitoring, especially in the morning and after taking your pills, can reveal hidden patterns that may surprise even your doctor.
Sometimes low blood pressure isn't caused by your habits or even your medications. Sometimes it's a signal, a red flag waving from deep inside your body. Your heart, your hormones, your blood, all parts of the same orchestra. When one instrument plays off-key, the whole rhythm shifts. And often that shift shows up first as a drop in blood pressure. Let's uncover the hidden conditions that may be quietly tipping your balance. 1. Heart problems. Your heart is your pressure pump. If it's weak or struggling to beat in rhythm, pressure can't be maintained. Conditions like bradycardia, slow heart rate, heart failure, arrhythmias, irregular heartbeat, aortic stenosis, narrowing of heart valve, all reduce your heart's ability to push blood effectively, leading to symptoms like fatigue, shortness of breath, and dizziness. Important: many seniors live with undiagnosed heart rhythm problems for years, until one fainting spell changes everything. 2. Hormonal imbalances. Your hormones act like internal thermostats, regulating how tightly your blood vessels constrict, how much salt and water your body holds, and how your pressure adjusts. Common culprits: thyroid disorders, especially hypothyroidism, adrenal insufficiency, Addison's disease, low cortisol levels. These issues often go unnoticed, especially in older adults, where symptoms like weakness or weight changes are blamed on age. Tip: if you feel unusually tired, crave salt, or get dizzy easily, ask your doctor for a thyroid or adrenal function test. 3. Nutrient deficiencies. Blood pressure also depends on blood volume, and that means healthy, oxygen-rich red blood cells. If your body is low in iron, causing anemia, vitamin B12, folate, it can lead to low blood pressure, brain fog, and cold extremities. Real story: a 67-year-old man in Michigan had recurring dizziness. Lab tests showed low B12, causing both anemia and hypotension. After a supplement routine,
his energy and balance returned within weeks. 4. Nervous system disorders. In conditions like Parkinson's disease or autonomic neuropathy, often related to diabetes, the body loses its ability to automatically regulate blood pressure when changing positions or stress levels. That's why some people feel fine lying down, but faint when they stand. Low blood pressure isn't always the problem, it's the symptom. And your job isn't to panic. It's to listen, investigate, and treat the root, not just the number.
By now, you know low blood pressure isn't always innocent. It can whisper for weeks, then knock you off your feet. But here's the good news. You don't have to be a doctor to detect it. You just need to become a better listener to your own body. Think of managing blood pressure like keeping a campfire burning. Too high and the flames rage out of control. Too low and the fire dies out. Your job? Keep it steady. Not too much, not too little. Let's talk about how to do that, starting right at home. Step 1. Get a home blood pressure monitor and use it right. If you only check your blood pressure at the doctor's office, you're missing 90% of the story. Buy a reliable upper arm cuff, not wrist or finger models, and follow these rules. Sit calmly for 5 minutes before measuring. Keep both feet flat on the floor. Don't talk during the reading. Check at different times of the day, especially in the morning and after taking meds. Note: if your systolic pressure is consistently below 90 millimeters of mercury or diastolic below 60 millimeters of mercury, it's time to call your doctor, especially if you have symptoms. Step 2. Keep a symptom journal. Your memory fades, but paper or a phone note remembers. Log times you feel dizzy or faint, what you were doing, what you ate or drank before, your BP reading if available. This can help your doctor find patterns you might not notice and adjust your care before things get serious. Step 3. Talk to your doctor and speak up. Many older adults stay silent, worried about bothering their provider, but your symptoms matter. Your story matters. Ask, could my meds be too strong? Should we check for thyroid, adrenal, or B12 issues? Is it okay to increase salt or fluids? Remember, your body is the expert. The doctor just helps interpret the message. Low blood pressure doesn't always need a prescription. Sometimes it just needs attention, hydration, and a few smart changes. And speaking of smart changes, low blood pressure doesn't always need a pill. Sometimes it just needs a little support, like propping up a young seedling so it can grow straight again. Your daily habits are the soil, the water, the sunlight, and even the smallest changes can help rebalance your pressure, naturally, safely, and gently. Let's look at what you can start doing today. 1. Drink more water before you feel thirsty. Dehydration is one of the easiest causes of low blood pressure to fix, but it's also one of the most overlooked. Aim for 6 to 8 glasses of water per day. Add an electrolyte drink, low sugar, if you sweat, walk a lot, or take water pills. Sip consistently throughout the day. Don't chug all at once. Imagine your bloodstream like a river. When it dries up, the flow slows down. Water keeps it moving. 2. Slightly increase salt, if your doctor approves. While most people are told to lower their salt intake, seniors with low blood pressure may actually need more sodium, especially if you're on diuretics. Add a pinch of sea salt to your meals. Use broths or soups with a moderate salt content. Avoid extreme low-sodium diets unless advised. Salt helps retain fluid, giving your blood pressure a gentle boost. 3. Eat small, balanced meals. Big, heavy meals can divert blood to the stomach and cause post-meal dips in pressure, especially in seniors. Eat smaller meals more frequently. Include protein, healthy fats, and fiber. Avoid high-carb meals alone, like plain toast or pasta. Think of meals like fuel stations. Small, regular fill-ups keep the system running smoothly. 4. Try compression stockings. Yes, they're not glamorous, but they work. Compression stockings gently squeeze your legs,
helping prevent blood from pooling and keeping it moving back toward your heart. Especially helpful during long periods of sitting, after meals, on plane rides or car trips. 5. Gentle movement is medicine. Movement helps your blood flow regulate itself naturally. Try short walks around the house, leg lifts while sitting, slow stretching in the morning before standing. If you stay still, your pressure stalls. But even light movement is like pumping the handle of a well. It gets everything flowing again. The key is consistency, not intensity. These daily habits are small levers. When combined, they lift your pressure just enough to keep you steady, safe, and strong.
Some signs are easy to ignore. A little dizziness here, a bit of fatigue there. But when these signals stack up, they start forming a bigger picture, a picture your doctor needs to see before it turns into an emergency. So how do you know it's time to stop guessing and start checking? Call your doctor if you experience frequent dizziness or lightheadedness, especially when standing up. Fainting, even once. Blurred vision that comes and goes. Cold, pale, or sweaty skin. Chest discomfort or rapid heartbeat. Mental fog, confusion, or feeling off. These aren't just aging. They're your body raising a white flag. And if your blood pressure is consistently under 90/60 millimeters mercury, even without symptoms, it's worth a conversation. At the appointment. What to say? Doctors are great, but they're not mind readers. You need to tell them exactly what you're feeling and when. Bring a log of your home blood pressure readings, notes about your meals, medications, and symptoms. A list of questions, so nothing gets forgotten. Ask about these common tests. To uncover what's really behind your low BP, your doctor may recommend Basic Metabolic Panel, BMP, to check kidney function, electrolytes, and hydration. CBC, Complete Blood Count, to look for anemia. Thyroid function tests, TSH, T3, T4, for hormonal imbalances. Vitamin B12 and folate levels, especially if you feel weak or mentally foggy. Electrocardiogram, ECG, to rule out arrhythmias or heart damage. Tilt table test, if orthostatic hypotension is suspected. Cortisol ACTH test, if adrenal insufficiency is a concern. Bonus tip. If you take several medications, ask, could any of these be too strong for me now? Medication needs change with age, weight, hydration, and lifestyle. You're not bothering your doctor by asking. You're advocating for yourself. And that one conversation might be what keeps you upright, alert, and independent for years to come. Let's take a step back. Low blood pressure may not have the same reputation as high blood pressure, but for older adults, it can be just as serious, sometimes more. It's quiet, subtle, and if ignored, it can lead to dangerous falls, hospital visits, or worse. But here's the good news. You have more control than you think. You now know the warning signs your body may be whispering, the hidden causes most people overlook, and the simple daily strategies that can rebalance your pressure naturally. Your action plan, starting today. Track your symptoms. Don't dismiss dizziness, fatigue, or fainting. Log them. Measure your blood pressure regularly, especially in the morning, after meals, or when you feel off. Stay hydrated and well-nourished. Water, balanced meals, a little salt if approved, your daily habits matter. Review your medications with your doctor. What worked 5 years ago might be too strong now. Speak up. You are not just getting older. You're getting smarter about your health. Remember this.
Your body is not broken. It's just trying to communicate. Every dizzy spell is a message. Every moment of brain fog is a clue. And now you know how to listen. Here's what to do next. Like this video if you learned something valuable. Subscribe to Senior Health Guide for weekly trusted tips. Share this video with someone you care about, because low blood pressure is more common than most people think. Comment below. Have you experienced any symptoms we talked about today? What helped you feel more stable? You're not alone. You're not helpless. And with the right knowledge, you are never powerless. Stay balanced, stay informed, and as always, stay safe.